everyone. My name is Sara Feld, and for my senior thesis, I looked at the definition of success for children with autism according to 3 different stakeholder groups: parents, teachers, and therapists, defined as speech and language pathologists and occupational therapists. So first, a little bit of background. No one has conducted any previous research on the definition of success for any disability population, including autism, leaving a large gap in the autism treatment and educational research. There are 2 reasons studying the definition of success is significant. First of all, understanding the definition of success leads to more effective programming in both schools and treatment facilities. For if all parties involved can agree on what the goals are for these children, then both educational and treatment programs can be designed more effectively with this in mind. The other reason has to do with my hypothesis, which was that these groups would not agree on what success looks like for these children. Though this turned out to be false, if all groups weren't in agreement about what success looked like, it could have led to conflicting standards, with children having to please their parents and teachers in conflicting ways. I arrived at my topic while working at my first field site over the summer, a speech and language and occupational therapy clinic called PACT in Hopkins, Minnesota. I worked there for 3 months. This clinic was designed for children with social communication disorders. I became interested in definitions of success when my supervisor, Dana, started discussing the importance of self-advocacy with me and how, in order to be successful, children needed to learn how to self-advocate. It got me thinking about what other people besides Dana thought of as success. So I decided to focus my research on answering the following question: how is success defined for children with autism across 3 different groups of stakeholders: parents, teachers, and therapists? Once the summer ended, I decided to expand my research to a second field site, Beloit Early Childhood, which I will from now on refer to as BEC, an early childhood special education program through the Beloit public school system. And I've been working there since September, and I'm still working there. Now I'm going to talk a little bit about my literature review. For my literature review, I looked at how 4 studies testing the efficacy of 3 different treatment approaches define a successful treatment outcome. For the first study, which looked at the low-VOS 40-hour-a-week behavioral intensive treatment, success was defined as the attainment of normal intellectual functioning and a successful placement in a mainstream classroom. Now, the interesting thing about this is low-VOS actually fails to say what a successful placement is. He doesn't define it anywhere in his study. For LEAP, a classroom-based intervention, success was, again, defined as a successful placement in a mainstream classroom. The researchers from this study also failed to define what a successful placement was. For floor time, which focuses on the attainment of appropriate developmental milestones, such as joint attention, the ability to engage in symbolic thought, and problem-solving skills, success was defined as the attainment of milestones based on observational data. To carry out my study, I conducted interviews with 5 parents, 2 teachers, and 8 therapists. I observed at PACT and BEC for hundreds of hours over a 10-month period. I then analyzed my data by transcribing the interviews and separating both the observational data and the interview data into the following categories that you'll see on the screen. So essentially, I themed my data, I transcribed the interviews, and I separated them into categories of defining a successful child, defining an unsuccessful child, and then for parents, I looked at hopes and dreams in both the long-term future and the short-term future. On the screen, you'll see a table with some differences between BEC and PACT. As you're browsing the table, I'm going to be talking about the differences in intervention models between PACT and BEC. First, at PACT, the children are organized into a play group with other children of similar functioning levels and do activities together to foster language, social, and motor skills. As the children are completing these activities, there is a speech pathologist assigned to each child. The speech pathologist observes the child interacting with other children and takes data on his or her goals. As they are taking data, they are also facilitating interactions between clients and prompting them to use appropriate social skills. When the appropriate skills are used, they are also praising the children. For this reason, the children are learning the skills incidentally, without even realizing that they're learning them. BEC, on the other hand, is designed to foster academic readiness skills for pre-kindergarten. For this reason, the activities are more teacher-directed, with periods of free play in between. Speech services are delivered in a small group format for 20 minutes a day and provided intermittently by pulling 1 or 2 children aside in the regular classroom setting. There are also fewer adults in the room at Beloit Early Childhood than at PACT, as there is only a classroom teacher, an aide, and a speech pathologist who comes in 1 or 2 days a week. For this reason, children at Beloit Early Childhood do not receive the same one-on-one attention which children at PACT receive. Here are some limits from my study. I was not able to interview fathers due to a lack of convenience. I was only able to interview mothers, as those just happened to be the people that came to me and were willing to be interviewed. I wasn't able to interview occupational therapists from Beloit Early Childhood because I ran out of time, unfortunately. There's no comparison data for teachers at PACT because there are no teachers at PACT, so that leaves sort of an inequality in the data. Children are a variety of ages and functioning levels, which again could affect the definition of success because obviously success is going to be in part defined on where the child is at and the age of the child. And also it was a relatively small sample size. Findings. First, I'm going to talk about parents a little bit. So, both sets of parents valued communication skills, the development of relationships, and the development of independence as the most important aspects of success. And I have a few exemplar quotes to support these conclusions. First, there was Nico's mother from Beloit Early Childhood who wanted him to develop better communication, and he was quoted as saying, "He doesn't verbalize. Communication is my biggest hope. He's very smart. Just communication is his barrier right now." Similarly, Emma's mother from PACT explained how she didn't expect her daughter to be toilet trained because she was learning how to speak. She was doing all this speech therapy to get her to talk, and so I came to the conclusion that I can't expect her to learn how to be toilet trained because she's learning how to talk. This demonstrates how this mother privileges speech over even toilet training, which I thought was fascinating. Every mother mentioned at some point in the interview the desire for their child to make friends. This was true across functioning levels. 4 out of 5 mothers interviewed also mentioned what they wanted for their children in the long-term future. 2 mothers said college, whereas 2 others mentioned wanting their children to have careers. Very surprisingly, this did not differ based on socioeconomic status. There were a few differences between parents from Beloit Early Childhood and PACT. Parents from Beloit Early Childhood used the term normal when asked what they wanted for their children in the future. They would make comments like, "I hope he'll be normal," or "almost normal." Whereas parents from PACT talked more about self-acceptance and of their children accepting their autism as part of who they are. Parents from BEC also had a hard time thinking about the long-term future unless pressed, leading me to believe that parents from BEC have a more present orientation, whereas parents from PACT have a more future orientation, as they had no issue discussing long-term plans. All therapists from both institutions agreed that an unsuccessful child is one whose parents are incompliant or uninvolved. This was my major finding from the therapist section. PACT therapists, however, were more apt to talk about following the treatment plan and the need for parents to be actively seeking treatments for their children, whereas BEC speech and language pathologists focused more on developing open communication between the school and the children's parents, which they saw as essential for treatment to be successful. PACT's director summed it up nicely when she said the following: "To be unsuccessful is to have parents that don't try." This is the message that I got from therapists across the board at both institutions. Similarly to parents, therapists valued children's ability to develop relationships and to develop autonomy. But one aspect which was not discussed by parents was the importance of early intervention. As BEC is an early intervention program, success is defined at their institution, in part, as acquiring basic cognitive concepts and early social communication skills. From PACT, however, there was also a therapist named Madison who emphasized the importance of early intervention and the development of those early cognitive milestones, such as joint attention, turn taking, and making requests. As several examples, if children are able to develop those skills, these were several examples of very successful outcomes. First, therapists from both institutions know without the development of those basic skills, children will not be as successful. There are at least two differences between how success is defined at Beloit Early Childhood and at PACT. First, therapists at PACT had many more facets of the definition of success than therapists at BEC had. This may have a lot to do with the age of the children which these two institutions cater to. PACT often sees children for several years, sometimes into the children's teenage years, whereas therapists from BEC only see the children for a year, maybe 2 years at most. Therefore, their perspective on an appropriate definition of success is much narrower. Therapists at PACT also had information on the success rates of their clients in the long term, as well as an idea of a more young adult version of success. Another difference was at PACT, the therapist desired that children be able to participate in mainstream early and middle childhood activities outside the center. This could be due in part to socioeconomic differences in the opportunities available to those at BEC versus those at PACT. No therapist from BEC mentioned enrichment activities, and I'm assuming this is because children from BEC may not have access to them in the same way that children from PACT do. Teachers. Though teachers agree with therapists that parental involvement is essential to success and that developing communication is a highly valued skill, success for teachers is defined as skill development. If children have the 5 abilities shown on the screen, they are considered successful. All of the stories which teachers told about successful and unsuccessful children involved these skills. Children who either started out as not having these skills and thanks to various types of intervention efforts now have them, or children who are still learning these skills and for that reason are still considered temporarily unsuccessful. One important and interesting point made by a teacher who I interviewed was that, according to her, children are never truly unsuccessful. There are just unsuccessful periods of time where you don't understand why behavior is occurring. In this way, the teacher framed success as a cooperative effort between student and teacher, in which both parties need to do their best and use strategies to help avoid breakdowns. In this way, she is taking direct responsibility for the success of her students, which is a wonderful attribute to see in a teacher. Discussion. Possibly due to age effects or the length of time each institution sees children, the definition of success at BEC is more present-oriented than at PACT, which I argue, at least in part, has to do with the purpose of the institution. The purpose of BEC is to prepare children for K-12 schooling, and as such, any speech and language therapy provided has a hidden curriculum goal of preparing children for the mainstream classroom. As soon as children can participate adequately in the classroom setting, the speech therapy is reduced or stopped, as those children are then considered successful. At PACT, however, children may be seen for years, even if they're doing very well in the school environment. PACT has additional goals for their clients, such as self-advocacy, being able to participate in common childhood life experiences, and community engagement, which were not a part of the larger picture for speech pathologists at at Beloit Early Childhood. This makes sense, as goals such as these may certainly be part of having a successful life, but may not be necessary to being successful in the school setting. If one looks more closely at the philosophy of PACT, one can see how the aforementioned goal would align with their purpose. So, to this end, I'm going to read you a quote from the PACT philosophy. The professionals at PACT Institute believe that learning is enhanced for children when they are engaged in interactive play, classroom, and community-based activities with a variety of peers across real-life situations and meaningful experiences. The social links curricula and treatment models reflect this belief and support the acquisition of functional developmental skills in day-to-day situations across functional settings. Real-life situations may include school, but the kinds of settings which Beloit Early Childhood which PACT as an institution is aiming to prepare students to succeed in is not limited to school, but is instead extended to a variety of settings which children and young adults may find themselves in throughout their daily routines. When speaking about BEC, however, one could argue that preparing children for school is by proxy preparing them for their whole life. For children who are unable to receive an education, usually face many challenges once they become adults, such as low employment rates, inadequate housing, and inadequate social support. Therefore, I do not want to argue that the narrowness of the teacher's definition of success is necessarily a negative attribute, for preparing young children for mainstream public education is one step towards ensuring that these children are going to have a successful life. However, it is only one step. Just because children are prepared for public education does not necessarily mean they are fully prepared for life after graduation. For it takes more than the ability to follow directions, to attain core content knowledge, and to engage in basic communication to be prepared for the thornier aspects of adult life, such as handling tricky relationship negotiations or how to handle situations in which one is being discriminated against. Socioeconomic differences between Beloit early childhood and PACT are numerous and obvious. These differences create a gap in what is expected of children at Beloit early childhood and PACT in their adult futures. This gap was especially pronounced between parents at Beloit early childhood and parents at PACT, which I argue stems from socioeconomic status. First, to return to an idea brought up in the findings section, both parents from Beloit early childhood expressed the desire that their children eventually become normal. This may reflect a lack of education on their part regarding autism as an identity and a disability, and reflects a lack of sophisticated thought about what would be best for their children's mental health and success. In other words, a desire on the part of these two parents for their children to fit more perfectly into the mainstream is a very easy answer to a very complex question of identity politics, an issue inherent to the idea of success regarding their children. However, 2 out of 3 parents from PACT expressed the idea that their children should learn to accept themselves, accept their challenges, and find their niche, which is a much more sophisticated way of thinking about disability and its implications for one's chances of being successful. I would argue that these parents likely have more education on autism, as well as its challenges and benefits. This is a direct result of socioeconomic status. For access to quality information is proportional to class. Without access to appropriate information on autism, as well as its benefits and status as an identity, one could very easily be led to believe that being normal is the desired outcome. Second, PACT parents came across as more empowered. For example, all parents from PACT mentioned school choice and treatment choice at some point in the interview. Parents from BEC, however, did not mention school choice, other than to express the desire that their children either be mainstreamed or attend school with children like themselves. Both parents from Beloit early childhood mentioned a waiting list for services, which they had been on for several years. The struggle to get help is clearly related to socioeconomic status, but they live in an impoverished area which does not provide these kinds of treatment services to families that can't pay out of pocket. To this end, neither child has received services outside of school. That in and of itself is an indicator of socioeconomic differences and definitions of success. For if parents don't believe that their child is going to be able to get help in the near future, and they believe that getting help is the key to their child's success, that parent is going to have a harder time envisioning success. In fact, I would argue that the parent would be less willing to think about future success and what success could mean for that child, and instead focus their energy on just trying to get through daily struggles. As one parent from Beloit early childhood was quoted as saying, "I don't really think about the future. I just think about the day-to-day." To conclude, all parties agree on how success should be defined for this population. That is, successful children are communicative, emotionally regulated, and are able to build relationships and have parents who are involved. The fact that all parties agree on this definition is important, for without this agreement, children may have received mixed messages about what is expected of them and how to be a successful adult. Besides giving credit where credit is due, it is important to mention that more could be done on the part of Beloit early childhood to enhance the children's chances of being successful beyond fitting into a mainstream school system. Including a social skills curriculum as part of the speech and language services, in addition to providing more direct instruction on self-advocacy skills, are 2 ways to improve the services being provided to children at Beloit early childhood and their families, in order to help them grow not only as students, but also as human beings. Finally, in a perfect world, success could be realized more fully if the divide between public and private services was broken down and high-quality care for children with autism became the norm rather than the exception for children of a lower socioeconomic class. Thank you. Any? Does anybody have any questions? Jacob.
What is self-advocacy?
Self-advocacy is the ability to stand up for oneself. Well, it's two things, actually. It's the ability to make sure that your wants and needs are met in an appropriate way, and it's also the ability to stand up for oneself in a situation in which one is being discriminated against. Does anybody have any other questions? Sonia.
How has your future, in terms of what you're thinking about doing professionally, how has that been impacted by what you've done in the past year?
Well, it's actually my internship at PACT that let me know that I wanted to be a speech and language pathologist. I've always known that I've wanted to work with children with autism. I've known that for many years. But I realized that speech and language pathology is sort of the right niche for me to be able to help this population effectively. And I learned that at the speech and language clinic that I worked at last summer. Does that answer your question?
Great answer.
Thank you. Does anybody else have any other questions? Oh my, Larry.
Sarah, one of your first slides listed 3 interventions, LOVAS, floor time, and LEAP.
Yes.
And I'm wondering, have those interventions, or which of those interventions have been adequately tested, and if they have been, then which of them work?
That is a very thorny question, Larry. Very thorny. LOVAS has been, the LOVAS 40-hour-a-week intensive behavioral treatment has been extensively researched. But the issue is most research studies that have been conducted have methodological issues. So for LOVAS, the sample size that he used, and to be honest with you, I forget exactly what the issues were, but there had been methodological problems with studying the LOVAS approach. But according to to certain sections of the autism world, that is considered the most evidence-based treatment because there have been the largest number of empirical studies designating that that's effective. The floor time approach, there's been one study conducted with 200 children. It was a sort of a case study. There was 200 case studies, and they looked at improvement over a number of years. But there were according to these developmental milestones, that's only one study, and I wouldn't exactly say that floor time is evidence-based. I don't know very much about LEAP. I'm not exactly sure how much evidence supports LEAP. Does that answer your question? I tried. I'm sorry. That's a big question. Yes?
You talk about socioeconomics and the influence on what parents think about the treatments that they can access. And I wonder if you, having some experience with this, sometimes it's not about socioeconomics, it's more about accessibility. So for example, in this whole area, if there's not a private therapy center, parents can't access it. So maybe rather than think about it in terms of socioeconomic possibilities, more about what's accessible to parents within, say, a 50-mile radius.
Thank you. I appreciate that. I was pressed to find sort of an answer at the end of my study, and that was the first one that I came up with, but I agree that that would have been a much better way to go about it. Thank you. I don't know who to call. I think you had your hand up first.
Interesting research. It made me think about some things I've read recently about disability and identity.
Mm-hmm.
And people on the autism spectrum claiming autism as an identity rather than something to be treated. And I was wondering if you have run into any of that and how it might relate to your research.
I haven't read a whole lot of research other than popular news articles talking about the neurodiversity movement. I can tell you my personal standpoint on the issue, which is that autism is definitely something. I believe that people with autism should be living in the real world. I believe that they should be included in the mainstream community, and that people with autism working to be able to be included in that community is important. So I do see autism, at least in part, as a deficit that needs to be addressed. But I also think that people with autism should be able to claim it as their own identity. So I play sort of both sides of the field in that way. But I do know people that believe that people with autism should be allowed to sort of create their own community, and that it's not necessarily a deficit, but something that should be embraced. But no, I do see it I do see it as a disability with deficits that need to be addressed. Does that answer your question?
The last question from
Bill.
I had a question about the mission of never-ending treatment, interminable treatment. Reminds me of Sigmund Freud, the interminable therapies that PACT has, that you can never be done.
It's true.
And I wonder if, to what extent you think that's a function of their status as a private provider, which requires that people continue to come back and pay the bill.
I believe that PACT wants what's best for its clients. I believe that they do discharge at a certain point. I do know people that after many years have managed to sort of leave and be successful. I don't want to think about PACT as that sort of an institution. I want to believe that they, will discharge people when the time is appropriate, and that they're not just, sort of holding people there for money.
Imply that they do it intentionally. I'm just wondering about the relationship between that model of therapy that could go on. It's actually about the success, what success means.
They have very high standards for success. It's true. I'm not exactly sure how to answer your question. I'm sorry.
We can discuss after.
Absolutely. Thank you.
Sarah.
I'm sorry I couldn't answer.